We're looking toward what happens next after learning this week about Planned Parenthood of Michigan's announcement to close health centers in Marquette and 2 others across the state. The move, effective by the end of the month, will make the closest Planned Parenthood clinics offering abortion care to be in Traverse City and Sheboygan. As leaders at Planned Parenthood said, the decisions come in the face of harsh federal funding cuts expected by the Trump administration. We're working to learn what impact the loss of service will have in the Upper Peninsula. My UP Skylar Perkins reports.
To our patients in our larger community in Marquette, we know that this is incredibly difficult. We know that folks are sad and are angry, and frankly, so are we.
After Wednesday's announcement that the Planned Parenthood Health Clinic in Marquette was set to close, many local medical professionals were all asking the same question. Who is going to see the patients who can no longer go there? See, however you feel about the federal budget cuts or abortion services provided by the clinic, those in the field also know that much of the work those clinics do involves preventative care and STD services. And if those patients aren't going to go to Planned Parenthood, where can they go next? An email from the State Department of Health and Human Services referred us to the county health department, but as we continued to seek answers, we spoke with a local ER doctor who previously worked at the clinic, who said she and the medical professionals she has talked to are worried many may find themselves with nowhere to go.
Planned Parenthood has been a resource in our community for decades, providing care to people who really need it and that have trouble affording it, and there aren't a lot of other options for those people.
She said the problem is a familiar one for healthcare in the UP.
We just have a general shortage of clinicians in the area. We don't have enough doctors. We don't have enough PAs. We don't have enough nurse practitioners. We don't have enough people to give all the medical care that is needed in our community. I know this. I've worked as an ER doc in the community for 9 years.
And according to her, the other big factor keeping patients away from care is cost. One benefit of Planned Parenthood compared to other providers is that the funding they receive helps them offer lower prices to people who need it.
Many other clinics can't take those patients who can't pay because they can't stay afloat if they take those patients. And so these patients might not have anywhere else to go.
We also spoke with current and former patients who told us Planned Parenthood was often already the only option they could find.
Broke in college, working full-time, trying to support myself. And so Planned Parenthood was really my only option. And so I drove the 2 hours there because it was the only option within 5 hours of the area to receive a chemical abortion. If it hadn't been for that care, I wouldn't have gotten screened for cancer.
Which in Aspen's case may have saved her life, as that cancer screen came back positive, and then the referral from Planned Parenthood helped get her fast-tracked with a specialist. In a follow-up, Planned Parenthood did tell us while the 3 centers are closing, they are expanding their telehealth offerings. You'll be able to find links to available resources and more from our conversations on our website. In Marquette, I'm Skylar Perkins for My UP News.